what's a heart-healthy diet. And I actually view that as part of a heart-healthy lifestyle. And it's actually for everybody in the whole family. You know, you can never start off by starting too young with having healthy eating habits, you know. So that starts off in pediatrics, you know, and then you build on that. And actually, if you're going to embark on a low salt diet and a fitness sort of routine because you're worried about your heart risk, your spouse or anyone living at home with you should probably do the same thing, and you've got more chances of success that way, you know. And it's not a one size fits all. So that's where I would say, you know, Sadi and I, you know, we focus a lot on prevention because we just see that there's so much of this that we know. Yes, we can deal with all the complex, you know, coronary artery disease and valvular heart disease, but we would much rather actually prevent complications and be able to make small interventions which are actually quite cheap, can prevent a lot of downstream medications and other, you know, harm and procedures and other types of things, and set you up for a healthier life.
Dedicated to educating our listeners about different health topics every week. And we do this by bringing on medical experts to answer commonly asked questions. Be sure to send your questions through Facebook Live on Wednesdays by 5 p.m. You can find more information about the show on our Facebook, Instagram, Twitter, YouTube, and our website, doctalklive.com. That's DOCTALK live.com. Also, check for more episodes of the show on platforms such as Spotify, iTunes, and iHeartRadio. My name is Dr. Paul Cespedes, and I'm hosting today's show. And joining us today, I'm very happy to say, welcome back to Dr. Sam Raza and Dr. Sadi Raza. And they're here to discuss the topic of heart health. According to the CDC, 1 in every 4 deaths in the U.S. is due to heart disease. And so it's a very important topic that we should know more about. So Dr. Raza and Dr. Raza, thank you so much for volunteering your time to be part of the show. Welcome again to Doc Talk Live. Please take a moment, tell our listeners a little bit about yourselves.
Thanks for having us. It's such a pleasure to be back. You know, we always look forward to this a couple of times a year. And so to all the listeners out there, it's great to be back with you today. So my name's Dr. Sam Raza. I'm a cardiologist. I have a focus on prevention as well as diagnosis and treatment of heart disease. And that kind of ranges from the whole spectrum of prevention, so how to prevent a heart attack or stroke, all the way through to lifestyle changes that we can use really in all age groups for adults. And then I also have a special interest in echo, which is a specialized form of ultrasound imaging of the heart, and also heart valvular disorders as well. So thank you very much for having me. I also practice here in Dallas, so I'm over at the Baylor Heart Hospital in Plano, and you can catch me online. We'll tag you with our links. Right. And I'm here with my husband.
Hey, thank you again, Paul. It's wonderful to be back again. I think season 7. We've been doing this for a while now, so we always have a lot of fun. I'm Dr. Sadi Raza. I'm a advanced imaging cardiologist at Medical City Dallas and Medical City Heart Hospital with a focus on preventative health. Like my better half said, we use imaging to basically treat and manage acute and chronic cardiovascular disease. But of course, the number one focus for both of us is to prevent heart disease, which in and of itself is probably the most important thing that we do.
Sure. Yeah. Well, thank you again. Welcome back. Okay, so since we're talking about heart health and being healthy, what is a heart healthy diet? I've seen that all over the place. I'm not quite sure what that means. Yeah. Could you explain that a little bit for us?
Yeah, we can. Yeah, do you want to go or shall I go? Yeah, okay. So I generally, you know, a heart healthy lifestyle includes both diet and exercise, and it looks so different for different people. You know, we've got types of food you might like, you know, people's work schedules, whether you work the night shift or shift work otherwise. And so generally what I recommend is what I consider to be a Mediterranean-based diet, okay? Generally plant forward. So we're talking about eating more plants, fruits and vegetables. I recommend lean proteins such as chicken, you know, grilled chicken, grilled meats where possible, avoiding processed or very fatty types of meats. I also recommend a portion of fish a couple of times a week, or at least several times a month. Things like salmon, mackerel, haddock, those are types of oily fish that can be beneficial as part of a heart-healthy diet. And then the big ones are really, avoiding processed and junk foods. So anything that comes out of a packet, that's kind of something I talk to my patients about. Low salt diet, looking at nutrition labels, really important, looking at the calorie, quantity, as well as the amount, serving size, paying attention to those things. And really, like we said, talking about processed and junk foods, avoiding fried foods, so grilling where possible, but avoiding a lot of extra additives and kind of things like that can really affect your weight gain. And actually those things don't have much nutritional value either, so they are generally can be harmful for you in different ways. So I generally recommend a Mediterranean based diet. Now we get asked a lot about carbohydrates as well,
right.
So I do recommend just intake of for example whole wheat pasta, whole grains, things that are complex carbohydrates that the body takes longer to break down, which makes you fuller for longer, but also helps to regulate your blood glucose, because many people out there have diabetes also, and that's a huge risk factor for heart disease. So those are the main things that I recommend. There's a lot of information in there, but I would say really just making small changes. If it's just cutting out sugar in your coffee, for example, or sticking to a non-fat creamer, for example, or non-fat dairy substitute, something like that is helpful.
I think those are great points. I think one other thing I'd add is make your plate colorful. So have greens and have oranges with citrus in it. And,
sure.
The more colorful your plate, the more balanced the diet you'll have. You'll get your fruits, your veggies, you'll get the oranges with the salmon.
Sure.
You'll get the chicken, you'll get the lean meats, and everything in moderation. I think Sam's point about don't drink your calories is a great point, because at the end of the day, excess calories in general just leads to harm over the course of time. But I would echo the fact that it's a heart-healthy diet has to be part of a heart-healthy lifestyle.
Okay.
So diet is only one pillar of this. So it's exercise, it's sleep, it's de-stressing, it's it's the entire combination of that lifestyle.
Yeah.
I'd also add, a plug for dark chocolate. We get asked a lot, like, what can I have? It's all boring. We don't want you eating a piece of cardboard, because that's not going to make anybody happy. You know? But just a plug for, for example, dark chocolate. There's some benefits there. It's got some nutritional benefit. It gives you a little bit of a sweet, flavor, which is nice. And we've shown in some of our observational cardiology data that it can be used as part of a heart-healthy lifestyle, and a diet. So think about that. Maybe lean for the higher dark chocolate content, that's also delicious.
Okay, I love that. I have a dark chocolate after dinner every day, good. So I love to hear that. Okay, so we talked about diet, and then you mentioned sleep, exercise, and de-stressing. What else can I do to reduce my risk of heart disease?
You got to know your risk factors first.
Okay.
So know your family history.
Okay.
Parents, siblings, when did they first have their first, when were they first diagnosed with high blood pressure? If they have diabetes, when did they develop diabetes? If they developed heart disease, at what age? What risk factors? And then know your own risk factors. What's your BMI? What's your blood pressure? Do you have uncontrolled high blood pressure? Are you overweight? Are you obese? So on and so forth. But you have to know yourself and your own risk factors before you can try and start avoiding them.
Okay.
So, an evaluation with a cardiologist is helpful, but also just talking to your regular primary care physician and understanding, they check your blood pressure, check your weight, they'll check various different things, including your kidney function, other types of things. Knowing your blood pressure is number one, knowing your cholesterol level, number two. I'd also say, knowing actually what your blood pressure tends to be, and I always say to people that keeping a track of that, you might notice the clues, such as if you go to the dentist, for example, blood pressure might be high, or seeing your doctors that you may see several times a year. That's a huge clue. It's a risk factor. We call blood pressure or hypertension the silent killer, for a reason. So it can cause damage to the kidneys, to the heart, the brain blood vessels, the back of the eye. There's so many different things it can cause, and actually quite quite treatable and preventable, to cause complications. And then we can do a detailed assessment as cardiologists. What we are trained for and what we love seeing is in the prevention sphere. So we're looking at people who don't necessarily have heart disease,
Right.
but we're looking to see what we can do to prevent that. And so
Sure.
there's many things that we can do with imaging, but just sometimes just simply a conversation and walking through your family history and deciding, where are you at? What is my risk for heart disease? I'm worried. Am I high risk? And what things can I do that
Sure.
can help to reduce that?
Sure.
Yeah, it's about piecing together a picture of the person in front of you. What's their LDL? What's their A1C?
Okay.
What's their age? What
Yeah.
medications they're on? What's their past medical history? And then taking that together and seeing, well, what's their risk, and can we bend that risk? Can we talk to them about getting their diabetes better controlled? Can we get their blood pressure under control?
Yeah.
Can we improve their diet? Are they sedentary? So both of us ask our patients regularly, well, how active are you?
Right.
They say, well, I walk. Well, can you describe what you mean by
Right.
do you walk? And,
Yeah.
and so on and so forth. And then together, it's almost like you have to create an individual sort of pathway to try and risk prevent and risk stratify the patient in front of you.
Yeah, this is not one size fits all, and I always say when you asked a great question about diet, what's a
Yeah.
heart healthy diet?
Right.
And I actually view that as part of a heart healthy lifestyle, and it's actually for everybody in the whole family. You can never start off by starting too young with having healthy eating habits, so that starts off in pediatrics,
Right.
and then you build on that. And actually, if you're going to embark on a low salt diet and a fitness sort of routine because you're worried about your heart risk, your spouse or anyone living at home with you should probably do the same thing, and you've got more chances of success that way.
Yeah.
And it's not a one size fits all. So
Right.
that's where I would say, Sadi and I, we focus a lot on prevention because we just see that there's so much of this that we know. Yes, we can deal with all the complex, coronary artery disease and valvular heart disease, but we would much rather actually prevent complications and be able to make small interventions which are actually quite cheap, can prevent a lot of downstream medications and other harm and procedures and other types of things, and set you up for a healthier life.
Yeah. And it's true. It does take, it's a team effort. And that's what I tell my patients too, is if you really want to be successful with this diet, or, because a renal diet is difficult to follow, it takes the whole family to be part of that, to help people to be healthier, eat healthier, so that you're not having one group eating all that
Right.
stuff and you're there with your
Right.
piece of cardboard.
Right. And it makes
yeah.
you feel, doesn't make
So-
you feel very good.
No, right. So you're right. It
And
definitely
we,
takes
and we
it
have
to.
good data on community interventions. So for example, you look at smoking prevention data.
Right.
If you have a smoker but their spouse or their friends are smoking, you're going to have a hard time to get them to quit smoking.
Right.
But if you intervene on the community and their sort of sphere of influence,
Yeah.
and all of them quit smoking, you'll achieve longer lasting abstinence
Yeah.
from smoking.
Absolutely. Yeah. Good. Okay. So, somebody has diabetes, high blood pressure. Clearly, they're at higher risk. Well, when exactly should they start getting screened? How early? Is it ever too early?
I probably would argue that it's not, but it's a team-based approach, so we always work closely with the primary care physician or other specialists who might be seeing the patient. There's many things, even just through a good talking to the person and taking a good history and examining someone. We can get clues about whether someone's had a heart attack before, what their circulation looks like, what the blood pressure is, talking to them about symptoms. So I would say it's really never too early. I would also say that for people who might be curious, if you do have risk factors such as high blood pressure, high cholesterol, diabetes, kidney disease, a combination of all of those factors can also increase your risk for heart disease. So I would say that, if you're worried, it's not difficult for us to figure out what that risk is, and in cardiology, we're fortunate to have quite sophisticated but specialized tests where we can actually look from the outside and kind of get insights into what might be going on and use some of that information to try and predict what's going on.
Yeah.
And that's, like I said, an individualized decision. It's something that we enjoy doing, and it's really gratifying when you can really help talk to someone about that information and they really make a change, and then they do well, and you can maybe change what the outcome might be.
Right.
So it's never too early. I would
Okay.
say if your physicians are worried or if you've got questions about what your heart disease risk is, go see a cardiologist.
Yeah. Okay. All right, Sadi.
No, I
Okay.
completely agree with Steve.
Okay.
It is never too early.
Yeah.
To at least figure out what's your risk factor to try and bend that curve.
Right. Okay. I love that phrase, bend that curve. Okay, so when they come to see you guys, and you're like, hey, okay, you're at high risk for heart disease. What's the treatment plan going to look like? I know you say it's very individualized, but just kind of a general picture.
I'm really big on lifestyle interventions because I feel like, and that we do recommend those for a period of either 3 to 6 months, and then we review and see what's going on.
Yeah.
But actually, if we can institute lifelong changes that can help you, that's definitely beneficial. I'll also say for my older patients, I do recommend physical activity as well, because I feel like the cardiovascular fitness level is so important as you age, and it's helpful if you are able to keep up with that. It really helps prevent a lot of complications such as falls or frailty. It's very important. But really it's a combination of blood pressure control, risk factor, what we call risk factor modification, so cholesterol control. Sometimes we use medications for that. It's also looking at markers. If we see evidence of, for example, coronary calcium buildup, inside your heart blood vessels. If you've got evidence of plaque inside your neck blood vessels, for example, the carotid arteries. If you've got evidence of changes on your EKG, the heart tracing that we check in the office, we get a lot of clues from that type of thing. So it's really about controlling a lot of those risk factors. And a lot of it does focus on blood pressure control and cholesterol management. So we're talking about treatments or interventions that we can do to try and reduce both of those two things. And then we're looking at other markers like your kidney function, your liver function, and other things such as your symptoms. Really important. Yeah. And we're then making recommendations on whether it be exercise or some form of stress testing, for example. That's another way that we look for clues to see what's under the surface. Is there any, and predictive as well. So it's a combination of all of those factors. Some of it involves medications. I'm big on lifestyle also, and I feel like sometimes those things are more effective and can actually, with good weight loss, can actually be more effective than medications in some situations. But we've got to be motivated and on the same treatment plan.
Yeah.
No, I agree. I think we take a big picture approach. If you see a patient, well, what's their BMI, what's their activity level, lose weight, become more active. Then you delve into, well, what was your last cholesterol panel? What was your last hemoglobin A1C? Delve into that. Yeah. Try and assess those. What's your resting blood pressure? Are you on blood pressure medications? Do we need to start you on blood pressure medication? Yeah. Go from there. What does your EKG show? And so on and so forth. So it's basically building blocks on building blocks, stacking up, starting out wide and then sort of narrowing the focus.
Sure.
But it all starts from, well, the person who walks in the room. Well, you get a feel for how they walk. Are they someone who walks with a cane or has a limp, and so you can sort of assess maybe they're not as active as they should be. Yeah. Are they obese? Can you improve their BMI and so on and so forth, and go from there.
I'd also just kind of talk about statins here for a second.
Sure.
Statins are a type of cholesterol medicine, as you may know, and listeners obviously may be familiar with. Yeah. People write a lot of articles about statins, and you hear about this a lot. And so I spend a lot of my time talking about this, in the clinic. Right. And what I will say is that statins are a type of medication that we have, in our little toolbox for helping to treat heart disease and controlling cholesterol. Yeah. And there are many, many different types of medications, Yeah. And certainly some people do have side effects from statin medications, but also on the flip side, we've learned so much through preventing heart attack and treating heart attacks and reducing heart attacks and strokes by using these types of medications. Yeah. And millions of people over now many, many decades have used these medications. So that's also a big component of a discussion that we have, Yeah. And like we said, it's individualized. So you may have had a bad reaction to a particular type of medication, but I would definitely have that discussion because it's a huge type of medication that we do use in cardiology and prevention. So just to kind of think there, and we actually work with patients, and I know sometimes it's over several months to years. We actually figure out what types of medicines might work for somebody with careful monitoring. But I would not underestimate the importance of those types of medications as well.
Yeah, Sam makes a great point that lifestyle adjustments are our first line, but we have to be realistic in how much we can achieve from lifestyle adjustment. Yeah. And there is a role for medications at some point, and that's where we try and work together with the patients to make them understand, well, why are we prescribing this medication? What's the benefit? discussing side effects and what's the long-term and short-term benefits of these medications. Because when we're in the preventative space, we're not looking at a 1 to 2 year to 5 year window. We're looking at windows sort of in the decades, you know, and Sam makes a good point. If we can get significant cholesterol reductions, plaque stabilization in your carotids or in your aorta, etc., the benefits will last for decades. It's not just a 1 year thing.
Yeah. Okay. Well, since we brought up medicines, okay, it seems that in the news, aspirin, we're back and forth on aspirin. It's good, it's bad, it's good, it's bad. So where do we stand on aspirin now? Is it going to help me with a heart-healthy lifestyle?
Right. I would say that one big public health message I'll say is please speak to your physicians before you make any major decisions about either starting or stopping aspirin. I'm sorry. Yeah. And we're referring to baby aspirin, preventative aspirin, I will say that what we do recognize is that in people who have risk factors or evidence of heart disease buildup, whether that's, carotid disease or calcium buildup inside the heart blood vessels, or if you've had a heart attack or a stroke before, there is benefit in taking aspirin, dependent on what your physicians say. If you don't have a high bleeding risk, in order to reduce the risk of blood clots and having a heart attack or other vascular type problems in the future. Now, there is also some role for those who we look at your heart disease risk, obviously. We call it the Ascvd risk score technically, but it's a complex integration of multiple different things, including risk factors, person's family history, various other types of things, that in people who don't have high bleeding risk, and we're looking specifically at bleeding from the GI system, head bleeds, that type of thing, that there may well be a role for those types of people as well, or certain types of people who have those particular risk factors. But there's, like I was saying before, it's not a one size fits all. So don't go stockpiling aspirin, at the grocery store. It's really an individualized decision, and it's a lot of gray zone. I'll be perfectly honest with you.
Sure.
So that's where all these little clues, all these little clues that we use, and sometimes it comes down to just a discussion, and lifestyle. Someone may not want to take a medicine every single day. They may be taking no other medicines, or someone might be really worried and they've taken aspirin for a period of time, and it wouldn't be more difficult for them to add that into their routine if they've got peace of mind. And bleeding risk factors is bleeding and prevention. So that's kind of what we're balancing.
Yeah, we got a lot of phone calls, text messages from primary care doctors, from physicians, and what we told them was, if you have a history of cardiovascular disease or a cardiovascular disease equivalent, so what's an equivalent? Diabetes, previous vascular disease, so strokes, carotid disease, lower extremity vascular disease, and you're already on an aspirin, there's a reason you're already on an aspirin. When you go into, should I just turned 65, should I start taking an aspirin? Now that's a different discussion. And that's where the gray zones come in, and that comes down to then individual therapy. But it goes to Sam's point, if you're already on it, don't stop it, at least without a conversation with your physician.
I'll also make a point about stroke and for women over the age of 75, and so what we do recognize is that risk for stroke and heart disease increases with age, that's in both men and women, but particularly we recognize that in women over the age of 75, the risk of stroke increases further. And so in certain patients of mine who are women, I really consider that discussion, what is the benefit of taking a preventive low-dose aspirin? Because I think it's worth a discussion, because we do recognize that women over the age of 75 can have an increased risk of stroke. So that's one sub kind of population I would just highlight in that discussion.
Okay, good. And since you kind of bridged into discussing about women, how common is heart disease in women? Because traditionally, I think we always think of it as like, it's, it only happens in men.
Disease, I would my second public health message for today is and I love being here, so it's wonderful to talk to you. Heart disease is the #1 killer of women. So I'll repeat that again. Heart disease is the #1 killer of women, and we have to recognize this. So traditionally, yes, there's a lot of press, and it's true. Men do have increased risk for heart disease as they age. That's true, and they can have more of the risk factors, and we recognize that based on old observational data, which is still true today. But women also, we need to be careful about both traditional and non-traditional risk factors for women. And so certainly what I'd like to mention is, if you're a woman and you're having symptoms of chest pain, shortness of breath, upper body chest discomfort, nausea, sweating, or just fatigue that seems unusual to you, those may well be cardiac symptoms, and it's very, very, very worthwhile getting checked out, because there may well be ways that we can, prevent having a complication or a heart attack. The other thing I'll mention is other unique risk factors to women and other conditions that can happen more so in women. So we're talking about inflammation, for example, things like microvascular dysfunction or coronary artery dissection, or SCAD, spontaneous coronary artery dissection syndromes, which can happen in women more so than men, based on underlying conditions, or just we recognize that this can happen. The other thing I'll also mention is, for example, pregnant women. So we see a crossover between those maybe who've had preeclampsia or high blood pressure during pregnancy. We call pregnancy informally like the stress test on a woman, so if you're having complications, that may increase the risk for future heart disease or hypertension.
Wow.
So another thing for women to be aware of, we're caregivers, traditionally have played that role. It's very important to get checked out.
Yeah. Okay, good. Okay, so we're approaching the end of this episode of Doc Talk Live. It goes way too fast. Remember to check out Facebook, Instagram, Twitter, and our website, doctalklive.com, to obtain more information about next week's show. Also, don't forget to like us on Facebook, Instagram, Twitter, and subscribe to our YouTube channel, and listen to our podcast on Spotify and Stitcher. Send questions in through Facebook to get them answered by our experts. Dr. Raza, we only have a few seconds left. Any last-minute quick tips?
Have a wonderful holiday season. Don't forget to work off those extra calories.
There you go. Love it.
Thank you for having us. It's great to be with you all.
It's always
today.
good to see you guys. All right, this is Dr. Cespedes signing off. Stay healthy, everybody.